Hello, welcome back to my channel. So my name is Gia. I'm your friendly family nurse practitioner. So today I am very excited to talk to you about a common complaint in primary care, which is fatigue, right? So this is a very common complaint, and I hope that this video will help you understand more understand your patient's fatigue more, and so that can guide your treatment recommendation, because fatigue is very vague, right? And so let me start. So fatigue, as a healthcare provider, fatigue is something I often encounter in patients. It's pervasive, and it's a feeling of tiredness that affects both their body and mind. Patients may describe feeling physically drained, and sometimes they say they struggle to concentrate because of lack of energy, or even finding simple tasks exhausting. Fatigue can stem from various sources, including medical condition, other medical conditions, lifestyle factors, or emotional stress. So, as a healthcare provider and nurse practitioner, very important for us to understand the root cause of our patient's fatigue. So, in my clinic, this is what most of my patients would say. So, Gia, I'm really tired. I have fatigue. Can you check my hormones? So they always want me to check their hormones. Does that sound familiar? So a lot of times, many of my patients attribute their fatigue to something more serious. And so they think that it's their hormones, or it's something sinister like cancer, and they think it's beyond their control. And so what are the common causes of fatigue? So lifestyle changes, social stressors, of course, because this can affect your sleep, right? If you're stressed out. Mood disorder is also can also cause fatigue. Medication side effects, substance overuse, infection, of other organic causes, infection, thyroid dysfunction, even malignancy can also cause fatigue. Chronic medical disease, but musculoskeletal is the most common, followed by psychological. Celiac disease can also cause fatigue, but then you're gonna have to ask about other associated symptoms. So history is everything, as with any other complaints in primary care. So make sure you do your due diligence in asking about HPI, any social stressors. For a new mom, lack of sleep is very common, so you're gonna have to assess that. Do they work night shift? If they're RN and they work night shift, you're gonna some of them will have fatigue, right? Sedentary lifestyle can also cause fatigue. Like I said, if they're not eating right, if they don't exercise, that can cause fatigue too, especially long term. Family history, so you're gonna want to assess about autoimmune. Some diseases has genetic predisposition, so this is important. Medication reconciliation, and for premenopausal women, inquire if they're having heavy menstrual flow, as they can be anemic and that can cause fatigue. And so this helped me though, so I really want to check or ask, what does fatigue mean to you when a patient come to me? Do you feel lacking energy, or do you have any lack of energy? Are you sleepy? Are you weak? Is that you just feeling weak? Are you short of breath? Some of them will not be able to describe it, so I've put it under unspecified, or and none of the above. And knowing this though can help you decide what to do as far as workup and your recommendations. So for lack of energy, the most common culprit is gonna be what are listed here. So depression, anxiety. For fibromyalgia, lack of energy is very common, but they also have insomnia, and they also complain of multiple joint pains or pressure points. They have a lot of pain. And infectious causes like hepatitis C, any infection can cause lack of energy. Medication side effects, multiple sclerosis, cancer, malignancy, and substance overuse. For sleepiness, generally, I would want to check for obstructive sleep apnea. Do they snore? And does their partner complain about them not breathing, or periods of sleep, like apnea? And poor sleep hygiene. So inquire about what time they go to bed. Do they turn off their devices, like their electronics 2 hours prior to sleeping? Do they drink coffee before they go to sleep? So you're gonna have to ask about those things. For assessment or for screening for sleep apnea, you can use the stop bang, and and then also if your patient have poor sleep hygiene, you might wanna discuss about proper sleep hygiene too. If they're more concerned about weakness, feel weak, like their legs, their extremities, and it's generalized muscle achiness and weakness. So we're gonna be going to dive into neurologic cause and myopathy for this type of fatigue. And if shortness of breath is a predominant, they feel short of breath, so they feel fatigue. So cardiac, anemia, and pulmonary causes are the most common culprit for it. So you're gonna assess too. Like I said, a lot of times these are constellation of symptoms. So inquire about congestive heart failure symptoms. Do they have orthopnea? Do they have paroxysmal nocturnal dyspnea? Do they have swelling? Are they having chest pain too? Or are they having palpitations? For anemia, you're gonna inquire about any blood in the stool, any, if it's a premenopausal women, inquire about heavy menstrual flow. And pulmonary, so, do they smoke, history of smoking, do they have asthma? Even asthma here can also cause shortness of breath and leading to fatigue. PE, pulmonary hypertension as well. So I put in a bucket for unspecified or none of the above, and I do inquire about symptoms not improving after taking a nap, and symptoms, ask about if their symptoms worsen with physical or mental activity. So as with any of this category, my initial workup includes make sure you do your vitals. So any abnormal vital signs, you're gonna have to be more concerned. Maybe send your patient to ED or urgent care for further evaluation or prompt evaluation. Physical exam. So this is a complaint that is vague and can involve a lot of the systems. So make sure you check heart, lungs, neuro. I'll do full neurological exam, psych as well. So use your PHQ-9 and G87. You're going to assess any thyroid enlargement, extremities. Remember, musculoskeletal can cause fatigue, musculoskeletal disease. I mean, any pain in their back, any pain, weakness, that will point you to what is the cause of fatigue, right? And so basic labs, you want to do a CMP. So I usually do CMP, CBC, urine HCG if I'm concerned if the patient is pregnant or if I'm suspecting that the patient is pregnant. So your want to check thyroid. For IgA, TTG, and total IgA, this is a celiac, checked for celiac disease. So if your patient doesn't have any GI complaints or any absorption symptoms, I'm probably gonna hold off. But you can do your SED rate, your inflammatory markers, because this can be elevated with autoimmune and infection too. And then UA, if the patient's having urinary symptoms. And remember, if they're complaining more of shortness of breath, you might want to check their EKG, just to make sure. And then if they're having some chest pain and chest pressure, I would want them to proceed to the emergency or advanced urgent care. And so there are other labs that you can also consider depending upon the risk factors of your patients, right? So Hep C, HIV, I probably will add my Hep B here too. Ferritin, phosphorus, calcium, CK, cancer screenings, and urine drug toxicity. Okay? So initial management if workup is negative. So some patients, even though I have maybe like 80-70% of my patients that complain about fatigue, I don't have any cause. And so, I also want to mention, you can also check vitamin D level too. All right, so if the initial workup is negative, so you're gonna encourage them to keep symptom diary, improve their sleep hygienes, and improve their exercise, increase their exercise, improve their diet, focus on symptom management, and consider behavioral health engagement if your workup is leaning towards their mood or mental health disorders, depression, anxiety, even fibromyalgia can also benefit from behavioral health therapies and frequent follow-up. With persistent symptoms and workup inconclusive, even after, right? So consider diagnosis of exclusion. So chronic fatigue syndrome or idiopathic chronic fatigue. Most of the time, if you just educate your patients. So we've ruled out autoimmune, we've ruled out cancer, we've ruled out any other symptom or disease that may cause fatigue. So you can reassure them, and then, like I said, frequent follow-up in any change in their symptoms. But, okay? All right. Okay, thank you for watching, and I hope that this improves your confidence in caring for patients with fatigue. And my hope is for you to feel comfortable. The more you do it, the better you're going to be at it. And I want to tell you, you did the right thing by becoming a family nurse practitioner. All right, thank you, and bye for now.